Hi, I'm Andy Leve for Hot TV, and today we are at the Charlotte Maxeke Johannesburg Academic Hospital, and sitting with me is Moira Gert from the Smile Foundation. Moira, nice to see you again.
Thank you.
Let's just find out a bit more about the Smile Foundation, when it started, and the people that you help.
The organization began in the year 2000. The late Mr. Nelson Mandela, who is our patron and who was the patron at that time, called our chairman, Mr. Mark Lovner, and said, I have a child that has facial paralysis, could not move any muscle at all in her face, and please, will you fix her up? Will you help her?
So 17 years now since the first surgery.
That's correct.
And how many other surgeries have there been since Tandor's first one?
In total, it's over 2,600 children that we've supported, in addition to helping the surgeons right throughout the year now.
So my duties here is to manage all the staff members here, including the parents and the doctors also. We're dealing with the plastic patients, so we admit all sorts of plastic patients, especially Smile, where we've got a patient with cleft lip, cleft palate, that are nursed from birth until whatever age, even up to more than, in the ward you admit up to 16 years of age. But after this kind of operation that they do, the child will show a little bit of smile on their face when they're smiling. And that hence the name Smile Foundation.
I've had a bit of a transformation here. I was wearing something else, but I now feel like I'm a doctor in an episode of Grey's Anatomy or something, but I won't be operating on anyone. But this gentleman next to me definitely will be. This is Dr. Tim Christofides, and he is one of the surgeons who operate on the kids from the Smile Foundation.
As a whole, the Smile Foundation actually assists us with many things. They don't necessarily fund each particular child, but they help us in many situations to actually get things done in collaboration with the hospitals,
Okay.
the provincial hospitals.
And today we are going to be speaking to Aden and his mom. And Aden is 2 years old, and I think he is having his surgery with you today.
Yes.
What stage of his surgery is he at today?
So Aden had a bilateral cleft lip palate, and he's had his lip repaired already. Okay, that was done when he was much younger, probably about 3 or 4 months of age. He then had already a first stage of the palate repair. The first stage of the palate repair is where we do the muscle reconstruction on the back of the palate, and we fix a little bit more than half of the back of the palate. And that's more the soft palate. Today we're going to be closing the front half of the palate. So it's his second stage of his palate. So this will be his third operation.
It's minutes before baby Aden goes through to have his cleft surgery with Dr. Tim, Prof. Tim rather, and he is behind me with his parents. And let's go chat to them a little bit to find out how they're feeling about the second procedure that Aden is about to have. This is surgery number 2, right?
3.
Number 3 for Aden.
Yeah.
Okay, and is it the last one of the processes?
The last one in the mouth, the last one will be
Okay.
like at a later stage when he gets older, when his face is more formed and grown, when they do like the lip fixing and the nose fixing, like the plastic surgery on the mouth.
Okay.
The lips there, like that.
Yeah. Well, let's not waste any more time. I think, we're wishing you strength.
Thank you.
And he looks like he's calm. So
Yeah, he's got a thing for the green, and he knows that he's going in, and something's not very nice or not good, so he knows he's going in for something.
Okay.
So he's got a phobia of green.
shame. Back at Charlotte Maxeke Hospital, standing outside the Smile Foundation's Facing the Future room. Baby Aden had his surgery a couple of days ago, and today we find out how he is doing. Let's see.
It was a shock when he was born, and then they took him out, and I just heard the sister say, "What's wrong with this baby?" And I'm like, they're all shocked, can't move, can't do anything. And then they showed my husband the baby, and then they asked if they could show him to me, well, Aden to me. And I was like, he said yes. And I just saw my son. I was like, what is wrong with my son? Because I've never in my life seen a situation like this either. I've never seen a child like this before either. It was a new thing to me as well. So that was quite shocking, very, very shocking. Well, immediately when Aden was born, after the doctors had him out, they went and phoned Smile Foundation. Well, they got hold of them immediately for us, immediately. So we were referred to go through Smile Foundation because they'll take us through the necessary steps, how to help us, what to do, because we were like totally lost. We don't know what's going on with the child. How do you take this baby home and you know what to do with him?
The Smile Foundation acts as a conduit, as an intermediary to enable the patients to get the right type of surgery and support that they need in a hospital environment. So we're like the middleman, facilitating and augmenting or complementing what the public health sector do at the present time. How it comes about is that either a parent will go to a clinic and they will be seen by the surgeons and then told they need a surgery, they must come on a particular date, or they phone in through social media, through radio stations and so on to us. And then what happens is our coordinators in the public hospitals, in those academic hospitals, ensures that they get to the right clinic and that they have transportation and they get to see a doctor.
Hot Cares on Hot 91.9.